much reflection. And also things like, what am I gonna have for lunch? There's a microwave and a fridge. What can I do? Okay. Hi everyone, welcome back for another video. So for today's video, I thought I would go through how I'm preparing for my next placement. So my next placement starts in about 3 weeks, but probably in less time by the time you see this video, or possibly I'm already on placement. So my next placement is going to be within the field of mental health. It's going to be a 10-week placement, so these are some things I'm doing to prepare beforehand. Okay, so my placement is going to be within the hospital setting. My last placement was within more of a private practice community setting. So we received a welcome document that had lots of information about the hospital, policies, what they expect from us, what they suggest we do, all those types of things. So of course, first of all, read any welcome documents, packages that they send you. Also doing your own research on the setting that you're going to, seeing if they have a website, looking at their values, policies, rules, mission statement, things like that, so you can get a sense of what's important to that clinic or that hospital, understanding their values. And also because it's a hospital setting, just refreshing yourself on hand hygiene, PPE, if you haven't been in a hospital for a while, the different policies, and each hospital might vary with the different rules and policies they have. Our next step is to call our clinical educator support officers. So this is something specific to the hospital I'm going to. The CESOs aren't in every placement setting you'll go to. So they're our first point of call. So they tell us at least 1 week before our placement to get in contact with them, introduce ourselves, ask any questions about the welcome information or further questions we have. And then if we have more specific questions, they can get us in contact with our specific clinical educator who will be educating us individually or in pairs. That makes sense. So from my understanding, the support officers coordinate the student placements and offer support to the students as well as the clinical educators. So when I do call the CESOs, am I saying that right? Yeah. When I do call them, hopefully today, things I'm going to be asking them, things like what's a typical timetable. They did give us information about that in the welcome package. They said 7:30 to 5, or it might be 8 to 4:30, those run about those times. And it also said that we can have 30 minutes for lunch and I think 2 10-minute breaks as well, somewhere in there. So just more practical questions like uniform, what do we need to wear, like clothes and shoes because it's a hospital environment, can't wear different types of jewelry, just all these types of more practical things. If it's not within your welcome document, maybe that's a chance to ask during this phone call, or if you email instead. I know for my last placement we emailed, but for this one they specifically said to call. And then if I do get in contact with my CE, things that I'll be asking are about the client population, generally what age groups, what conditions do we typically working with a lot of the time. If they have suggested readings or assessments, models, frameworks that they use a lot in the setting and they think would be beneficial for us to revise or learn beforehand or have a heads up about before we go into the placement. Some other things that we all have to do are complete admin forms, whether that's things to show our different vaccinations, immunizations, that we've completed different modules that are requirements, as well as they also suggested that we do a learning styles quiz, which we did in my last placement, as well as it can help your CE and yourself understand how you learn best and see if both of you can possibly modify the way you communicate and teach and learn so it best matches you as the student. Did that make any sense? And I think my quiz came back, I'm multimodal, meaning that I learn from like visual, auditory, kinesthetic, doing things. So yeah. Next thing I'm doing is researching the field of mental health in general. So as a YouTube creator and watcher for many years, I know that there are already a heap of videos and just general content on the internet about the different perspectives within the mental health field. So from nurses, doctors, mental health technicians, occupational therapists, as well as people who were clients or patients within this setting. I think it's really valuable to try and gain a greater understanding of multiple people's perspectives and experiences within the different fields. It's also great to see, day in a life, what each person's roles are, what their priorities are. Obviously, it's very dependent on the specific hospital or specific community setting for what a nurse's role or an OT's role is. However, it just gives you an idea, and that's what I really hoped to give to you guys with my vlogs, to give you just an idea of what it may be like, what it could be like. It's never going to be exactly what happened to me, it's going to happen to you type thing, but just to give you some insight and some idea of what it could look like. Next thing I'm doing is speaking to students who have had placements either in the exact same place or in the mental health field in general, and seeking out their experience and their tips. Another reason I created this channel. So I can do that for you if you feel like you don't have anyone else. So like, what's the goss? What do you recommend doing beforehand? If you go back in time and tell yourself to do something, what would it be? Thank you for telling me. What's your timetable been like? Have you had to work outside of those 8 to 5 or 8 to 4 hours? Have you had to continue working on things after hours? What's the client population been like from your side, age groups, conditions? What's the typical client or patient that you're seeing? Really using your friendships and your networking with other students or other health professionals within the field you're going to go in, that you're going to experience soon. Use them as much as you can. Tips, strategies, stories, what they can share with you. It's all valuable. Also, more practical things. Trying to figure out what I'm going to take, diary wise. They recommend we have a diary. So folders, what documents do I really want to be carrying around with me all the time if I don't have a locker? And I went back through all the documents and all my folders from my last placement and went through and looked at what reflection sheets, what templates and things that I really found useful for myself. Looking at my past learning goals, as something else we have to do beforehand is create our learning goals. So that's something we have to do. And so looking back on what my learning goals were and how they changed during last placement, considering what I would like to get out of this placement, looking at my results from my last placement and feedback, what I would like to improve on, what I want to keep doing, what I want to change, things like that. Just a whole lot of reflection. So much reflection. And also things like, what am I going to have for lunch? There's a microwave and a fridge. What can I do? Okay. So just a little bit more on those learning goals. This is just a quote from our welcome document. So these should reflect the student's aims and objectives for the specific placement, as well as feedback the student has received from previous placements. So as I said, reflecting on what you've done in the past, what you need to improve on, and also because it is a different setting, what's something you really want to achieve. So I might be running more or working in more group therapy programs. So I didn't do a whole lot of group therapy programs in my last pediatric placement. We did do a prep program. So running those type of groups is going to be possibly take slightly different skills as to running groups with 5-year-olds, 6-year-olds, 5-year-olds, compared with 20 to 70-year-olds. So yeah. And of course, going through all of my lecture notes and tutorial notes from the past 3 years, and sifting through, I went through because I can keep everything. I sifted through just a massive pile of notes and pulled out things that I thought would be important or relevant for this placement. And after I talk to my CE, I will get a better idea of what different conditions, different concepts, models they would like us to revise beforehand. So I pulled out things such as content we did on depression, anxiety, psychosis, when we did some pharmacology lectures on medications you'd find in a mental health setting, dementia, different assessments, the wellness program, risk assessment and management. Hey everyone, so future me, later on me, I just wanted to show you a few of the different topics I'm going through. And so I've gone through all my notes and kind of picked and pulled different things that I think would be useful for me to revise for my placement. So I'm just going to show you a few of them. Is, for example, the model of human occupation, so MOHO. Another lecture I'm going through is about pain and the experience of pain and different theories, as it had content relating to mental health as well. Then also going through some content on groups, group therapy, as I think that will possibly be part of my role in my next placement, running groups or being part of creating groups in the mental health setting. We also did content on motivational imaging, motivational interviewing, stress management and relaxation techniques, communication support for people with mental illness, and we had some content on trauma and abuse, types of trauma, the ranges of different interventions, some content on working with childhood trauma, and some content that I really did enjoy was learning more about the mental state examination, the mini mental exam. So we went through that and learnt what we should be looking for, and I think we watched some kind of case study videos and practiced doing the assessment. We also did some risk assessment in mental health, as well as some content on dual diagnosis and more motivational interviewing. I think something else that will be good to revise is legislation and standards within mental health, as well as things like continuation of care into the community with regards to mental health, and obviously any lectures surrounding OT interventions in the mental health setting. Alright, so those are just a few lecture topics that I'm revising. Back to the video. Just all these things that popped out to me. We've done a fair bit of mental health content, so I think I'm going to have a lot to go through, as well as researching myself and finding recent and relevant literature in the mental health field, not just by occupational therapists. So seeing what's current and hip-hop happening in the field may give me, hopefully will give me a better sense of maybe what I'm walking into. You know what I mean? So keeping up with literature, searching out. So I know MOHO, the MOHO model, is going to be most likely heavily used in this field. So looking at MOHO assessments, different literature around MOHO, and there's some videos on YouTube that I think students have done for assessment about MOHO. So I'm a multimodal learner, so I'm definitely watching a bunch of YouTube videos to get ready for this placement. Alright guys, thank you so much for watching. Click here to subscribe, share, comment, like, all those good things, and I'll see you in the next one. Bye.